With the ongoing surge of the Omicron variant on the verge of overwhelming Oregon hospitals, we've also heard that there could be a silver lining to all this uncertainty.
That's the idea, that this variant is getting so many people sick so fast that it could help usher in an end to the pandemic. Fox 12's Simon Gutierrez is live in Northeast Portland for us with why some expert thinks that is possible. Simon?
Yeah, we heard recently from Dr. Anthony Fauci, the country's de facto COVID czar, and he said that eventually pretty much everyone will come down with the Omicron variant of COVID-19. What that means is complicated, but also potentially promising. With the highly contagious Omicron variant ripping through the state of Oregon and the rest of the country, daily case counts have reached record highs and hospitals are again pushed to the brink. But as quickly as the Omicron wave appears to be cresting, computer models predict it will also quickly recede, which offers at least a glimmer of hope.
There is a silver lining in it, pending on more epidemiological evidence, because so far, the virological evidence and clinical evidence indicate Omicron, while it's highly infectious, but less capable of causing serious symptom or harm.
Junwei Chi is director of the Center for Global Health at Oregon State University. He says if the evidence of Omicron being less severe holds true, it could mark a turning point.
Omicron might be the virus that helped us to end this pandemic, to turn it into an endemic or the so-called flu-like. But again, we still need more evidence. Myself, I'm waiting for maybe another month of epidemiological data.
That said, there is a catch.
I mean, a pandemic is by definition a global disease.
Courtney Campbell is director of the Program for Ethics, Science, and the Environment, also at OSU. He says the only way to guarantee the end of the pandemic is to make sure every country in the world has adequate supplies of vaccine.
The Petri dish for developing a new variant in the same way that Omicron developed out of South Africa is still there.
Still, there is reason for hope that COVID-19 could become a more tolerable part of our lives. To get there, Chi says 3 promising possibilities would have to be realized. Annual deaths would have to come down to levels closer to the seasonal flu, more effective treatment options would have to become available, and the evidence that Omicron is less severe would have to hold true.
Then I'm quite hopeful. Under those 3 conditions, we might see the end of this pandemic sometime late spring or this summer in some countries such as North America and Europe.
Yeah, of course, there are a lot of variables to consider there, but with the Omicron variant not expected to peak for at least another week or so, these are welcome possibilities to consider. Reporting live in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.